So I just want to draw your attention to the artwork on my title page. I want to thank my friend Oliver, who's an artist with medical training, who has created some beautiful artwork for me to use with my patients. And you'll see a link on the next slide. So as a PT who treats pelvic pain, I'm going to use this session to tell the story of two people who have a prostate, who had pelvic pain that was not of prostatic origin. It always surprises me how many people are surprised that pelvic pain occurs in people other than cis women. And my goal in this talk and in general is to just add to the conversation that pelvic pain happens both across the lifespan and across what we could call the gender span, and it's multifactorial and complex. So as I said, I work with people of all genders and all ages, and despite my goal to be less binary, I was asked to talk about male pelvic pain. And so this talk is really about cisgender men or people with that anatomy, but not necessarily people with that identity. And I like to say that my work requires consideration of anatomical structures, but my care incorporates people's gender identity. And so for the purposes of this talk, I am referring to two cisgender men, and I don't mean to exclude trans men, but this is what we're doing today and at this time. So imagine, if you will, that a person with a prostate presents with these complaints: pelvic pain that includes genitals and low back, and maybe also abdominal pain. They may also have urinary dysfunction, sexual dysfunction, bowel dysfunction, and they may report stress and depression, persistent pain at other locations in their body. I think that both of the speakers who came before me did a wonderful job of presenting the scenario and how complicated it actually is. And in thinking it through, if we're reading about pelvic pain, the literature is overwhelmingly about bodies with a vagina. And the information about other bodies is largely prostate related. Jeanette Potts is a urologist who has done extensive writing and may have coined the phrase prostatocentric thinking in the medical community in men who present with pelvic pain. So I am a physical therapist, and my orientation is towards the musculoskeletal with hopefully a perspective that includes the differential diagnosis. So what I want to do is take you through the four categories of chronic prostatitis, chronic pelvic pain syndrome. I'm sorry that your slides have a typo that says CPSS instead of CPPS. And then we're going to look at two ways of two kinds of questionnaires for this patient population. I just want to also say before we go further that pelvic floor pain could be considered a syndrome more than a disease. As such, it often fails to respond to monotherapy approaches. And I think part of this, I think my colleagues who spoke before me addressed this, is sort of these cycles of escalation that you have something that precipitates pain, and then your body responds to the pain and responds to the response to the pain, et cetera, et cetera. And it was interesting to hear Greta speak about fissures, because I oftentimes find that fissures occur in people who have a history of pelvic floor overactivity, and that the bracing that occurs may contribute to that. So we're in a soup all together here. If we want to look at the categories that are historically used to look at chronic prostatitis or chronic pelvic pain syndrome, they would be these four categories. And the first is acute systemic bacterial infection. The second category, the type 2, is a recurrent UTI with bacteria in the prostate between infections. Type 3 is known as chronic prostatitis or chronic pelvic pain, not caused.
Hey guys, thanks for watching. To continue, please log in or create an account for free. Thank you for your support.